right. Which of the following is the most appropriate next step in management of this patient? All right, 68-year-old man presents to clinic with a pulsatile abdominal mass that he incidentally discovered while showering. He has a history of hypertension, hyperlipidemia, denies abdominal pain, back pain, lower extremity weakness. On examination, this pulsatile mass palpated the midline of abdomen just above the umbilicus. An abdominal ultrasound reveals a 6 centimeter infrarenal abdominal aortic aneurysm. Which of the following is the most appropriate next step? Okay, so the ultrasound revealed that. I don't know if you jump right into surgery. I know you have to do something. This can kill you, but I'm wondering if you would do a CT angiography. I'm not going to do beta blocker. I'm not going to do statin. I don't think you can wait 6 months to just repeat like that last question, because these are, I think, a little more life-threatening.
Okay.
I'm wondering if you do immediate surgical repair or you're going to do further imaging to really understand where it is in that abdominal aorta. But I mean, they know exactly where it is from the, not that ultrasound's going to pinpoint it. I just know there's something like, if you're a smoker over 65, I think the guideline is like, yeah, they have to get a CT, maybe not every year, but like a CT of the abdomen at some point. So I can't remember the exact rule, but the thing is they already imaged it. So why would you need another image? Why would you need another image? Maybe because like ultrasound was just done at bedside and now they're just trying to, I think you have to image it before surgery. Like I think you need a finer image of where this is before surgical repair. But it's kind of, they say exactly where it is. I don't know if you need CT angiography or you could just go right into surgery. I think, again, I would guess on the less invasive measure and do the CT.
Yeah. So
Okay.
exactly. So let's, I think the way you're thinking about questions, right, in general, and especially this question is great. That's kind of how I'd be
Okay.
thinking, right?
Okay.
You're like, okay, as a surgeon, do you have enough, right? In my mind, right? Me being a surgeon, I'd be like, okay, an ultrasound is not super great. And, this surgery, even though, on an answer, it's just like, oh, go for surgery, right?
Right.
Also on top of that, immediate surgical repair. Just as a side note for test taking,
Hmm.
anything immediate, you got to be thinking that are they like dying? You get what I'm saying?
Okay. But you
So
can die from this kind of quick,
you
right?
can,
Like,
you can,
okay.
you can. But what I'm trying to say is, when I'm thinking immediate surgery repair, right? I'm thinking like, oh, this thing has already busted open,
Okay.
right? An aneurysm that
Okay.
has popped, there is no time for imaging. You get what I'm saying?
Gotcha. You just got to go in. Okay.
You just got to go, right? Do you need surgery repair for this? 100%, right? But
Yes. Okay.
do you have time to get a CT angio, which takes like 30 minutes
90.
to do? The
Oh,
answer
okay.
is yes,
Oh, it's not like
right?
regular CT. It takes 90 seconds. It takes long. Is it with contrast? Is that
No,
why?
I'm talking about like waiting for it, getting
Oh,
contrast,
okay. Okay.
all this stuff, right?
Okay.
So, like the scan itself will only take like 90 seconds, but getting everything done, right, probably takes 30 minutes, an hour, or whatever
Okay.
it is, right? But yeah, you have time, right? You'll get more information. It'll help your surgery out, right? Because you'll know exactly, like you said, exactly where it is, right? You'll be able to know the vessels that are near it so that when you're doing surgery, not to nick any other vessels, right? And,
Hmm.
it'll help you a lot. But observation not good. So this is key, right? So it's actually okay if it's less than 5.5. There's a diameter, okay,
Oh,
that they
okay.
like.
I didn't
So
know
if
that.
they're small, then they have, like, I guess the literature shows that it's unlikely to rupture, so you can watch it. But this one is over
Okay.
5.5. Beta blocker, right? Like I said, right, if it's small, then you can start doing the conservative things and watch.
Okay.
Same thing with statins, but anything greater than 5.5, you're thinking surgical repair. And before you go into
Okay.
surgical repair, it's always good to get an image, that that is appropriate for the surgery, right?
Okay.
Ultrasound is
Like a
good for us.
before, right? Like a before image
Yeah,
in a
before
way.
exactly.
Okay.
Exactly.